Hello, this is Angel. Let's study foot anatomy together. Alright, so feet are a crucial part of the body, supporting the body's weight, allowing for movement, and contributing to overall well-being. So feet are extremely important. The feet are complex mechanical structures that contain 26 bones, 33 joints, and over 100 muscles, tendons, and ligaments. Alright, so the function of feet is to allow wide range of motion, including walking, running, jumping, and maintaining balance. Your foot's health is very important for overall well-being. Untreated foot problems can cause pain and dysfunction in other parts of the body. Mobility. Healthy feet allow for proper form, balance, and stability, which can help you achieve your fitness goals. Safety. Healthy feet can reduce the risk of injuries. Relationship to the rest of the body. There's a two-way relationship between foot health and overall health. For example, diabetes can affect foot health. Alright, so muscles of the feet. The first plantar layer, excuse me, the mnemonic is flying ducks, brave and dynamic moves, right? So muscles, the feet muscles have four layers. The first plantar layer is the most superficial of all layers, right? The muscles are abductor hallucis, flexor digitorum brevis, and abductor digiti minimi. All right, so this is flexor digitorum brevis, this is abductor digiti minimi, and this is abductor hallucis, right? So the first layer has flexor digitorum, and then abductor digiti minimi, and abductor hallucis. Let's talk about the second plantar layer. Quiet please, lazy, macho, flexing digitorum longus, and flexing hallucis longus, right? So the muscles are quadratus plantae lumbrical muscles. The tendons are flexor digitorum longus and flexor hallucis longus, right? So quiet please, quadratus plantae, lazy, macho, lumbrical muscles, flexing digitorum longus, FDL, flexing flexor hallucis longus, right? So that's the layer number 2. All right, so as you can see, right, this is the macho trying to flex digitorum longus and hallucis longus. These are the lumbricals, right? 1, 2. This is quadratus plantae. This is plantae. Flexor hallucis longus, the long band, as you can see. That's flexor hallucis longus. And this is flexor digitorum longus, right? So this is flexor digitorum longus that is actually going to 1, 2, 3, 4. All right, so going to 4, right? And this is the only one that is flexor hallucis longus. That's layer 2, right? So third plantar layer, right? Flying high, big, obvious, and train, hulk of adduction, heading, future dynamo, mini blizzard. I just made that up. So flexor digiti, flexor hallucis brevis. So that is flexor hallucis brevis with sesamoids. These little dots that you see are sesamoids, right? Flexor hallucis brevis, oblique and transverse heads of adductor hallucis. So this is oblique, right? As you can see, this is oblique, right? Alright, so and transverse heads of adductor hallucis. This is the transverse head of adductor hallucis muscle, right? It's a flexor digiti minimi brevis, right? So that's a flexor digiti minimi, this particular. So flying high, big, obvious, and train, hulk of adduction, heading, future dynamo mini blizzards, right? So Hulk is actually famous for adduction, right? He would catch something and then put them down, right? So adduction, right? As you can see, Hulk is in adduction position. And there's a mini blizzard, and you know the chances are we are going to have a future dynamo mini blizzard, right? So Hulk is flying high, big, obvious, and train. Hulk of adduction, heading future dynamo mini blizzard, right? So that's the third plantar layer. The fourth plantar layer is dead eye plant IV. So fourth layer is the deepest layer. Muscles, dorsal interosseous, plantar interosseous. The tendons are peroneus longus, tibialis posterior. Both tendons travel to their insertion point via fibro-osseous tunnels, right? So layer 4, interossi, so 1, 2. Peroneus longus, so this is peroneus longus. tibialis posterior. This is tibialis posterior, right? So this is the fourth plantar layer, and that is the deepest layer, right? All right. Arches, all right. So arches are very important. The foot has three arches, two longitudinal, medial, and lateral arches, and one anterior transverse arch, right? They are formed by the tarsal and metatarsal bones supported by ligaments and tendons in the foot. Their shape allows them to act in the same way as a spring, bearing the weight of the body and absorbing the shock produced during locomotion. The flexibility conferred to the foot by these arches facilitates functions such as walking and running, right? So arches help the foot support and distribute the weight of the body and provide leverage during walking, all right? So arches are very important. This is the lateral malleolus of the fibula, right? So this is the lateral fibula. Fibula is lateral. Tibia is medial, right? So that's the talus, that's navicular. These are two cuneiforms, metatarsals, right? As you can see, metatarsals. These are the phalanges. As you can see, this is the transverse arch, and these both are medial and lateral, right? So this is the lateral, and that's the medial, right? Medial is more on the side of the body, right? All right, so lateral part of longitudinal arch. So this is the lateral part of longitudinal arch. That is calcaneus, and this is cuboid, right? So as you can see, all these arches are literally binding each and every bone together, keeping the structure intact, right? All right, so longitudinal arches, there are two arches in the foot, medial and lateral arches. They are formed between tarsal bones and metatarsal bones, right? The medial arch is the higher of the two longitudinal arch. It is formed by calcaneus, talus, navicular, three cuneiforms, and first three metatarsal bones. It is supported by muscular support tibialis anterior posterior, fibularis longus, flexor digitorum longus, flexor hallucis, and the intrinsic foot muscles. Ligament and support plantar ligaments, the long plantar, short plantar, and plantar calcaneo-navicular ligaments. Medial ligament of the ankle joint. Bony support shapes of the bones of the arch, right? Other plantar aponeurosis. The plantar aponeurosis is a modification of deep fascia, which covers the sole. It is a thick connective tissue that functions to support and protect the underlying vital structures of the foot. The fascia is thick centrally, known as aponeurosis, and is thick along the sides, right? So plantar aponeurosis is also very important because medial arch actually support. So as you can see, this is the transverse arch, this is the lateral longitudinal arch, and this is the medial longitudinal arch. As you can see, all these arches are supporting the foot to be firmly grounded by making sure that each and every bone, as you can see, the calcaneus, the tarsals, the metatarsal, the phalanges, they're all together. You know, it feels like they're tied down, right? So arches kind of make sure that each and everything is, you know, fully together. At the same time, when you have plantar aponeurosis, so if this is plantar aponeurosis, it goes like this. So what it actually does is plantar aponeurosis also provides a very strong base for the arches and the bones to stay steady, right? So it is like a pad. It's a thick connective tissue, right, that functions to support and protect the underlying vital structures of the foot. Fascia is thick, centrally known as aponeurosis, and is thin along the sides, right? So it's actually thin along the sides, but thick in the middle. Why? Because it has to bear the body weight, right? All right. The lateral arches, so this is the medial longitudinal arch. This is the lateral longitudinal arch. The lateral arch is a flatter of two longitudinal arches and lies on the ground in a standing position. It is formed by the calcaneus cuboid and the fourth and fifth metatarsal bones. It is supported by fibularis longus, flexor digitorum longus, and intrinsic foot muscles, right? Ligamentous support is plantar ligaments, long plantar, short plantar, and plantar calcaneo-navicular ligaments. Bony support is shape of the bones of the arch, and plantar aponeurosis again, right? So transverse arch, the transverse arch is in the coronal plane of the foot. It is formed by metatarsal bases, the cuboid, and the three cuneiform bones. The musculus of fibularis longus and tibialis posterior, right? So that's the muscular support. Ligamentous support is plantar ligaments, the long plantar, short plantar, plantar calcaneo-navicular ligaments, and deep transverse metatarsal ligaments, right? So that is the long plantar ligament. This is a long plantar ligament. This is tibialis posterior. As you can see, this tibialis. That's plantar calcaneo-navicular ligament, 1, 2. That is tibialis anterior. This is short plantar ligament, and this is fibularis longus, right? All right. So the wedge shape of the bones of the arch. So the bony support provides the wedge shape of the bones of the arch. Alright, so what is pes planus? Pes planus is a common condition, as you can see, it's flat feet, in which the longitudinal arch have been lost. So there are no longitudinal arch. That includes median and lateral. They are not there. Alright, so it is either they are just not there or they haven't fully developed, right? Arches do not develop until 2 to 3 years of age, meaning flat feet during infancy is normal, right? Pes cavus is a foot condition characterized by an unusually high medial longitudinal arch. This is unusually high medial longitudinal arch, right? It can appear in early life and become symptomatic with increasing age. Due to the higher arch, the ability to shock absorb during walking is diminished, and an increased degree of stress is placed on the ball and the heel of the feet, right? So due to higher arch, the ability to shock absorb during walking is diminished. So imagine having a really high arch. Chances are arches are anyways responsible for, shock absorption. So if you have a really high arch, that which kind of means that your heels and the ball of foot will be playing a bigger role, right? So what happens is that it causes a lot of stress on the ball and heel, you know. During situations like this, either you have an orthotic that supports the arch, right? So a podiatrist would actually recommend an orthotic right here, or provide you with shoes that are meant only for you, because as you can see, an arch here is also causing an abnormality here, right? Because that's not how our feet are, right? We don't really have this curve right here, right? So one structure is impacting another structure. Why? Because there is just not a lot of shock absorption, and these are taking a lot of stress. So that stress is kind of pushing upwards. So slowly and gradually, you'll start not only having pain on the ankles, you'll have pain on the knees, and you'll feel weak all day long because of overexertion, right? So that's why doctors would, either suggest you treatments, surgery, and or an orthotic, where you can actually handle the stress very well, and your heels and bones are not that impacted, right? Surgeries like these are much more impactful when you get them done when you're younger than during your adulthood. It is possible, but in adulthood you require a lot of therapy, okay? Plus surgery, plus multiple appointments of podiatrists. It's a little time consuming. While if you do it when you're much more younger, before, let's say, 14, 15, then chances are your body will be able to take it, The reason being is that when you're younger, even younger, let's say 11 years, less than 11 years old, then your bones can be very easily molded. They're moldable, right? All right. So let's talk about bones. The average person walks around 7,500 steps per day. That's equivalent to around 5 laps of Earth's equator in a person's lifetime. Between the left and the right foot morphology, there's always some difference, as no 2 feet are the same. So your 2 feet may be different. There might be slight difference, right? All right, so this is the lateral view of our feet, of our foot, and this is the superior view of our foot, right? As you can see, this part is called as phalanges. This part is called as metatarsal. This part is called as tarsal. These are all interphalangeal joints. These are metatarsal phalangeal joints, right? Right. So that is interphalangeal, and these are metatarsal phalangeal, right? So as you can see, these are metatarsal because these are metatarsal. These two are sesamoid bones, like these little bones are sesamoid bones. That's a proximal phalanx. That's a middle phalanx. This is a distal phalanx, right? The big toe, that's the big toe, right? That's an intermediate cuneiform. That's medial cuneiform. That's a cuboid. This green one is Talus. This is Calcaneus, right? This is navicular. All right, so that's a lateral cuneiform. This particular baby here is a lateral cuneiform, right? All right, if you see it from the lateral view, that's navicular. That's a talus, this green one. That's a fibula, right? When you're on lateral side, the first bone that you see is the fibula, and when you're on the medial side, the first bone you'll see is the tibia, right? So this is the tibia. That's a calcaneus, right? This particular part. All right, so this is the forefoot, this is the midfoot, and this is the hindfoot, right? All right, the bones of the foot provide mechanical support for the soft tissues, helping the foot withstand the weight of the body while standing and in motion, which is true, right? Tarsals, a set of 7 irregular shaped bones, right? So tarsals are 7, and their shape are not, they vary. They're irregular. There is no definition of the shape, right? They are situated proximally in the feet in the ankle area. So these are all the tarsals that you see here. They're irregular shape. No two shapes are the same. One's big, one's small, they're different shapes. Metatarsal connect the phalanges to the tarsal. They are 5 in number, 1 for each digit. So 1, 2, 3, 4, 5. So there are 5. Phalanges, the bones of the toes. Each toe has 3 phalanges, right? Proximal, intermediate, and distal, except the big toe, which only has 2 phalanges, right? So 1 and 2. The big toe has 2, the rest have 3, right? The foot can be divided up into 3 regions: hindfoot, talus, calcaneus; midfoot, navicular, cuboid, and cuneiforms. Third is forefoot, that's a metatarsal and phalanges, right? I personally prefer to divide in 3 groups like this because this is much more easier to understand, right? All right, so tarsal bone distal group and the proximal group, right? All right, so mnemonic for learning tarsal bones. The tarsal bones of the foot are organized into 3 rows: proximal, intermediate, and distal, right? So tiger cubs need milk, all right? So tiger cubs, talus, this is talus, that's calcaneus. That is need, that's navicular, right? Milk, that is medial cuneiform. Intermediate cuneiform, right? This is the intermediate cuneiform. That's the lateral cuneiform, and that is the cuboid, right? This is a cuboid shape, right? So tiger cubs need milk. All right, so tarsal bones, blood supply. All right, so lateral tarsal arteries, branch of dorsalis pedis, right, the longest artery that supplies blood to the lateral side of the foot, including the tarsal bones, and extensor digitorum brevis muscle, right? The lateral tarsal artery runs under the extensor digitorum brevis, right, muscle, and anastomosis with other arteries near the ankle joint. So this is the ankle joint, and that's where the anastomosis happens. Dorsalis pedis artery, this is the dorsalis pedis artery, as you can see, right? Continuation of the anterior tibial artery, that this is, as you can see, this is anterior tibial artery. When it reaches on the dorsum, it is called as dorsalis pedis artery. All right, so supplies blood to the tarsal bones and dorsal aspect of the metatarsals. Dorsalis pedis artery anastomosis with lateral plantar artery to form the deep plantar artery. All right, so it forms deep plantar artery. Posterior tibial artery, this is, as you can see, the posterior tibial artery. Why? It's on posterior side and on the tibial side, right? Enters the sole of the foot. It enters the sole of the foot, as you can see here, through the tarsal tunnel. So as you can see, it's coming over here through the tarsal tunnel. Artery of the tarsal canal, right here. There you go, right? So tarsal tunnel splits into the medial and lateral plantar artery, which supply the plantar side of the foot, right? Supplies the plantar side. This is the plantar side. All right, the tarsal canal artery, as you can see, artery of the tarsal canal. A branch of posterior tibial artery that supplies blood to the head of the talus. The deltoid artery, all right, so deltoid, a branch of posterior tibial artery, this is the posterior tibial artery, supplies blood to the head of the talus, right? So it supplies the head of the talus. As you can see, there's a deltoid branch right here. And this is the talus, so it's supplying the head of the talus, right? Talus is a bone of the foot that transmits forces from the tibia to the heel bone. Does that make sense? So talus is more or less like a shock absorbent between the tibia and the heel bone, right? Talus vascular supplies depend on the fascial structures on the connective tissue, which can lead to avascular necrosis if the supply is compromised, right? So there are higher chances that talus would be much more susceptible to avascular necrosis, right? Because there's less of vesicles if the fascia is, let's say, it's damaged. Tarsal bone innervation. The tarsal bones receive nerve supply from tibial nerve which branches into several nerves within the tarsal tunnel. The medial calcaneal nerve, a sensory branch that supplies the medial heel. Medial plantar nerve, a mixed nerve that travels deep to the abductor hallucis muscle and branches into the common plantar and proper plantar distal nerves. Lateral plantar nerve, a terminal branch that supplies sensation to the lateral third of the soles of the foot and lateral 1.5 toes, right? So that's the lateral plantar nerve, right? Okay, this is the medial plantar nerve, right? These are the calcaneal nerves, right? So you can actually see that this is the medial side of calcaneal nerve, right? So one's medial, one's inferior. So this is inferior and that's medial, okay? All right. A nerve that can be compressed in tarsal tunnel syndrome, leading to pain, paresthesia in the inferior heel. So this can be particularly compressed, okay? The proximal group, right? We saw that proximal group, and there's a distal group, right? Proximal tarsal bones are the talus and the calcaneus, right? So this is the talus, and this is the calcaneus. These are the proximal bones, right? All right, the talus is the most superior of the tarsal bones. It transmits the weight of the entire body to the feet, to the foot. It has three articulations: one superiorly ankle joint, inferiorly subtalar joint, and anteriorly talonavicular joint, right? So ankle joint superiorly is between talus and the bones of the leg, that's tibia and fibula. Inferiorly subtalar joint between talus and the calcaneus. Anteriorly talonavicular joint between the talus and the navicular. The main function of the talus is to transmit forces from the tibia to the heel bone known as the calcaneus. It is wider anteriorly compared to posteriorly, which provides additional stability to the ankle. Whilst numerous ligaments attach to the talus, no muscles originate from or insert onto it. This means there is a high risk of avascular necrosis as vascular supply is dependent on fascial structures, right? So like we said earlier, avascular necrosis is very much of a possibility if there is damage to fascial structure, because vascular supply is fully dependent on the fascial structure. Okay, and as you can see in this particular image, right, as you can see, there is some sort of necrosis that's happening in the talus, right here. Alright, so this is the talus, right? The articular surface with distal end of the tibia. This is the distal end of the tibia right here. Articular surface with medial malleolus. This is where the medial malleolus is. That's lateral tubercle groove of flexor hallucis longus right here. This is the body, right? This is the head, neck, and this is the anterior side, right? This is articular surface for the navicular bone, right? We have a navicular bone right here. So this is the articular surface. This is where it starts, right here. That's the medial view. Inferior view, when we look from the downside, right? So that is posterior from the back. Posterior calcaneal surface, right? Because that's where you get connected to talus calcaneus, which is a proximal group, right? A groove for flexor hallucis longus, right? And again, there's a flexor hallucis. This is medial calcaneus surface. Articular surface for calcaneonavicular ligament. Articular surface for navicular. Anterior calcaneal surface. Alright, so avascular necrosis of talus. Avascular necrosis of talus is a condition that occurs when talus bone in the ankle loses its blood supply and dies, right? So avascular necrosis of talus occurs when talus bone in the ankle loses its blood supply and it dies, right? Because the blood supply, the vascular supply, is fully dependent on the fascial structures. So what happens when we are having AVN? We are having necrosis of talus. Pain, swelling, limited range of motion. It can be due to trauma. It can be over steroid use. It can be alcohol abuse. It can be blood disorders. Diagnosis. How do you diagnose it? Physical exam, x-rays, MRI, bone, PET, CT, right? Treatment, medication, surgery, or no treatment at all, right? You're asked to rest a little. Arthritis, stiffness, joint function, and reduction. Okay? Surgical options include ankle fusion, decompression of talus, a muscle flap to restore blood flow, or a bone graft. All right. Total talus replacement is a surgical procedure that involves replacing the talus bone with a custom designed metal bone. So they would just replace it with a metal bone. 3D printed titanium truces. Custom made 3D printed titanium truces can provide promising outcomes for treating severe AVN of the talus. Right, so you not only have a total replacement with a metal bone, but you can also have replacement with 3D printed titanium truces. Calcaneus, right? The calcaneus is the largest tarsal bone and lies underneath the talus where it constitutes the heel. The calcaneus, also known as the heel bone, is the largest bone in the foot and is located at the back of the foot below the ankle joint. Calcaneus plays a key role in walking and connecting the calf muscles to the foot, right? So it connects the calf muscles to the foot. It has two articulated superiorly subtalar calcaneal joint between the calcaneus and the talus, interiorly calcaneocuboid joint, right? We saw that there was a cuboid connected to it between the calcaneus and the cuboid. So there are two joints, talocalcaneal and calcaneocuboid. It protrudes posteriorly and takes the weight of the body as the heel hits the ground when walking, right? So whenever you walk, the first foot, that will touch the ground would be your calcaneus, right? And this is exactly why many folks suffer from plantarfasciitis. Why? Because that's where they have bone spur that's clumping out, right? The posterior aspect of the calcaneus is marked by calcaneal tuberosity, to which Achilles tendon attaches, right? So calcaneal tuberosity functions, calcaneal tuberosity to which Achilles tendon attaches, right? And that's why many folks have Achilles tendonitis, which also affects the calcaneus. Function of the calcaneus: transfers body weight. The calcaneus transfers most of the body weight for the lower limb to the ground. Liver arm: the calcaneus acts as a liver arm for the Achilles tendon. Subtalar joint: the calcaneus forms a subtalar joint with the talus, which allows the foot to move in and move out, right? So this particular joint with the talus, the talocalcaneal joint, allows the foot to move in and move out, right? A broken heel or a calcaneus fracture can occur due to trauma or high impact events like fall or car accident, right? Symptoms include sudden heel pain, swelling around the heel, bruised heel, and ankle, right? Depending on the severity of the break, pain, stiffness, and swelling may last for months or even indefinitely. Most people can return to normal activities after they are fully recovered. Well, it kind of depends on your lifestyle too. If you have to be constantly on your feet for work, then a calcaneal pain can be, very, very difficult to handle. Okay, so if you're somebody who's having issues with calcaneus, I suggest you do not wait. Go ahead and go to a podiatrist and ask them for solutions. Okay, so let's talk about the muscles that are connected to calcaneus. Triceps surae, gastrocnemius, and soleus, right? So I'm not sure if you can see it, but that is gastrocnemius right here, right? All right. Both together are known as triceps surae. So this is soleus. This particular side that goes on the on like this is the soleus. Middle facet of posterior surface of calcaneus through calcaneal Achilles tendons, right? Abductor hallucis. The abductor hallucis, this particular one, is the abductor hallucis, and right here, as you can see, it's connected. The origin is medial process of calcaneal tuberosity, right? We just saw where the calcaneal tuberosity was in the image before. Flexor digitorum brevis, alright, so this is flexor digitorum brevis, right? So this is flexor. The origin is medial process of calcaneal tuberosity and plantar aponeurosis. The whole thing, the cut is plantar aponeurosis, right? So that's where the origin is. The quadratus plantae, media surface lateral process of tuberosity. Alright, so that's the quadratus plantae. Quadratus plantae right here, right? The medial surface of lateral process of calcaneus tuberosity. Okay. Abductor digiti minimi, origin the medial lateral process of calcaneal tuberosity. medial and lateral process, right? So this is medial, this is the lateral process of calcaneal tuberosity. Extensor digitorum brevis, right? So the extensor digitorum brevis, the origin is dorsal lateral surface. Extensor hallucis brevis, dorsal surface and tarsal sinus. Two. All right. What do gastrocnemius and soleus do? They're responsible for plantar faction, right? They're responsible for plantar faction. All right. Blood supply. The blood supply is posterior tibial artery. The medial side of the calcaneus is supplied by the branches from the posterior tibial artery. The medial calcaneal branch of the posterior tibial artery. And posterior tibial artery is the main blood supply to the heel pad. So right here. Alright, so posterior tibial artery, as you can see, it starts from here, and the branches are right here. Medial. Calcaneal branches of posterior tibial and lateral plantar arteries. Very important, right? Alright, so lateral calcaneal artery, this particular is the lateral calcaneal arteries, branches of the peroneal artery, right? Alright. Lateral side of calcaneus is supplied by the lateral calcaneal artery, which can branch off from either posterior tibial or peroneal. Peroneal is fibular. So this is posterior tibial and this is peroneal. Alright, so it can branch off through either or. Sinus tarsi artery. Sinus tarsi supplies about 10% of calcaneus, and it has to be somewhere right here, right? Sinus tarsi artery. Lateral plantar artery. So this is particular is lateral plantar artery right here. Right? Anterior part of the calcaneus supplied by the lateral plantar artery. The calcaneus also has a watershed area, right, in the middle where the medial and lateral interosseous arteries exist. Right? What is a nerve supply, right? As you can see, this is posterior tibial tendon. Posterior tibial nerve, medial calcaneal. Oh, this is Baxter's nerve right here. That's a lateral plantar nerve, and this is a medial plantar nerve. The calcaneal nerve supplies the skin and the muscles of the heel and the sole of the foot. The medial calcaneal nerve, a branch of the tibial nerve that supplies the skin of the medial heel and the sole of the foot. It originates in the tarsal tunnel, which is located behind the medial malleolus, right? So the medial malleolus right here, it's located behind, all right? Medial malleolus at the ankle, right? The medial calcaneal nerve can originate medial calcaneal nerve from either the tibial or lateral plantar nerve. Inferior calcaneal nerve, also known as Baxter's nerve. This is what they're talking about. This nerve is the first branch of the lateral plantar nerve. It arises from the tarsal tunnel. So it arises from right here, right? So this is the Baxter's nerve, right? At times there is an inflammation in the Baxter's nerve as well, right? Lateral plantar nerve, a motor nerve that supplies the intrinsic muscle soles of the foot, right? So lateral plantar nerve. This particular is the lateral plantar nerve. Alright, so this is calcaneal tuberosity. This is a posterior facet. This is peroneal tubercle. Lateral process of calcaneal tuberosity. Alright, so this is a facet for cuboid. The sinus tarsi right here. That's the anterior process, right? This is a lateral surface, by the way. So if you look at it from the lateral side, that's how it looks. Posterior surface, that's superior facet. Retrocalcaneal bursa, this is medial. Achilles attachment, right? So this is where the Achilles tendon will be attached. That is the inferior facet. Alright, so if we see it from the anterior surface, the anterior process, posterior facet, middle sustentacular facet, sustentaculum tali, right? This is this particular area. That's anterior facet. Facet for cuboid right here. So when your anterior cuboid is also connected to the calcaneus. This is the calcaneal tubercle, this particular hump here. That's medial process of calcaneal tuberosity. That's the lateral process of calcaneal tuberosity. Right? So this is also the same. It's just that it's on the medial side. Alright, so let's look at the clinical case study, right? A T2 MR image demonstrating patchy edema within the navicular indicates a likely presence of avascular necrosis in the navicular bone, as the increased signal intensity on T2 weighted images typically signifies bone marrow edema hallmark finding in early stage AVN. So this is AVN stage, but it's an early stage. As you can see, bone marrow edema, the patchy edema. The patchy edema seen on T2 image remains fluid buildup, right? As you can see, there's a fluid buildup when the bone marrow of navicular, which is characteristic sign of compromised blood supply leading to cell death in AVN, right? The navicular bone of the foot is particularly susceptible to AVN due to limited blood supply, making this finding clinically relevant. While this finding is suggestive of AVN, a comprehensive clinical assessment including patient history, physical examination, potentially further imaging studies may be needed to confirm the diagnosis. Right, so physical examination and imaging studies needed for the further diagnosis. But from the initial T2 MR image, this fluid buildup, it looks like it is AVN on the early stages. Okay, so what are metatarsals, right? We just had a conversation that there are 5 metatarsal from medial to lateral, right? Each metatarsal has similar structure. They are convex dorsally and consist of head, neck, shaft, and base, right? Base. All right, this is from distal to proximal. So this is the distal, so that's head, neck, shaft, and base, right? All right, so they have 3 or 4 articulations, proximally tarsal, metatarsal joints between the metatarsal bases and the tarsal bases, laterally intermetatarsal joints between the metatarsal and the adjacent metatarsal. Distally, metatarsal phalangeal joint between the metatarsal head and the proximal phalanx, right? So as you can see, the base, the shaft, and the head, right? So it starts like this. And these are 5. 1, 2, 3, 4, 5. Features of the fractures of the metatarsal bone. Metatarsal fractures can occur by 3 main mechanisms. The most common method of fracture is a direct blow to the foot, usually from a heavy object dropping onto the foot. Another type of metatarsal injury is a stress fracture, an incomplete fracture caused by repeated stress to the bone. It is common in the athletes and occurs most frequently at the necks of the 2nd and 3rd metatarsal and proximal 5th metatarsal. As you can see, there's fracture right here, right? Metatarsal can also be fractured by excessive inversion of the foot, right? If the foot is violently inverted, the fibularis brevis muscle can avulse, tear off the base of the 5th metatarsal right here. Alright, so what is metatarsalgia? The metatarsalgia bones are 5 long bones extending from the ball of the foot, connecting your toes with the ankle bones. Sometimes this area of the foot becomes painful and inflamed, a condition called as metatarsalgia. Alright, so there's certain sports activities. So let's say if you run a lot, walk a lot, you're not wearing the right shoes, you're wearing flip-flops, you're wearing too tight. High heels, very important. If you're wearing high heels, just make sure it's not for the longer duration. Foot deformities, we just had a chat, right? We had a chat about flat foot, base cavus, base planus, right? So if you have a duck feet, very flat, then chances are metatarsalgia cannot be avoided, right? Morton's neuroma, so during Morton's neuroma, that may happen as well, right? Extra weight, if you have too much extra weight, then you will feel like my metatarsals are actually, in general, I think your foot will have issues, and that's why people that have extra weight cannot walk for a longer duration of time, especially those that may have a belly. Yeah, stress fractures in metatarsals are very common, right? We just saw one of the stress fracture. Blood supply, dorsalis pedis arteries supplies the dorsal aspect of the metatarsal and tarsal bone. It also contributes to blood supply of the toes, right? So dorsalis pedis artery, very important. Dorsalis pedis artery and then posterior tibial artery, very important on the posterior side. We can't see it here, but like we just saw earlier, the posterior tibial artery on the posterior side splits into medial and lateral plantar, right? So medial and lateral plantar, as you can see, medial tarsal and lateral transfer, right? So These arteries supply the plantar side, the medial and lateral plantar. So it is on, on the plantar side. So you can't see it in this particular picture because this is a dorsal view. But if you look at it inferiorly, then you will be able to see posterior tibial artery, dividing into the medial and lateral plantar arteries, right? Dorsal metatarsal arteries supply blood to metatarsals. The first dorsal metatarsal artery branches off to feed medial face of the second metatarsus and lateral head of the first dorsal metatarsal muscle. The plantar metatarsal arteries supply blood to metatarsals. The fibular plantar marginal artery, an inconsistent branch of the lateral plantar artery that supplies blood to the fifth metatarsal. Metaphyseal arteries supply blood to the base of the fifth metatarsal. Right? Phalanges. The phalanges are the bones of the toes. The second to the fifth toes of all have proximal, middle, and distal phalanges. The great toe has only two proximal distal phalanges. They're similar in structure to metatarsal. Each phalanx consists of a base shaft and a head, right? So that's the distal. Distal is away. That's the middle, and that's proximal. Only the big toe has two, right? The distal and the proximal, right? And the remainder of the four have the middle, the yellow one, right? Fractures may either be non-displaced or displaced. This particular one is non-displaced. This particular one is displaced, right? Non-displaced is that there is a crack. There's a bone crack, but the ends of the bones are together, right? So as you can see, there's a bone crack, but the ends are together, right? Nothing happened to the bone. It's just a minor crack, right? You can call it a hairline crack. Displaced where the end of the broken bones have partially completely separated, right here. Completely separated. As you can see, it's dislocated. Right? Alright, so we talked about sesamoids before. What are they? Alright, two small pea-shaped, right here, two small pea-shaped bones embedded in tendon below the first metatarsal, right? Closest to the big toe on the bottom of the foot, right? They're on the bottom of the foot, right? Their job is to strengthen and reduce the stress on the tendon, right? So what are they doing? They're protecting the tendons, right? So this is medial flexor hallucis brevis muscle. These are the two sesamoid tendons. These are the two, and these are the two sesamoid bones. That's the lateral flexor hallucis brevis muscle. Lateral flexor hallucis brevis, right? Sesamoiditis is result from overuse of tendons surrounding sesamoid bones, such as varying high yields or sports activities that can lead to irritated and inflamed, right? So inflammation of sesamoid bones right here. This is flexor hallucis brevis. Inflammation of sesamoid bones, right? I personally really feel that sesamoiditis is very common with those that wear heels or tight sandals, tight shoes. Alright, so blood supply, dorsalis pedis artery, posterior tibial artery, supplies the tarsal bones and dorsal aspect of metatarsal, contributes blood supply to the toes through deep plantar arch, right? Posterior tibial runs along the side of nerve of the same name and enters the sole of the foot through tarsal tunnel, splits into medial lateral plantar arteries, alright? Medial plantar artery supplies to the great toe. Alright, so medial plantar always supplies to the great toe. Lateral plantar gives rise to a plantar arch of the foot which curves across the base of the second, third, and fourth metatarsal. Plantar metatarsal arteries branch off from this arch to supply the four webs and the digits, right? As you can see, this is a perforating branch of fibular artery, this particular one. Lateral tarsal artery, because that's where the tarsal is. The deep plantar artery, right? This deep plantar arch. This is the deep plantar arch, right? Alright, so this is the medial plantar artery, this particular one. This is main dorsalis pedis. This is posterior tibial artery, right? Very important for the everything posterior. That is the anterior tibial artery, right? So very important for everything anterior. That's a fibular artery. Comes from fibula. Joints. The ankle is a hinge type of joint, right? We have ankle as a joint type synovial joint that involves the distal ends of the tibia and fibula and the superior part of the talus. Foot joints are grouped into four: Major types, which are intertarsal, tarsal metatarsal, metatarsophalangeal, and interphalangeal joints, right? So this is fibularis longus tendon. All right, as you can see, this is calcaneal cuboid joint right here, calcaneus and the cuboid. That's a calcaneal tubercle, right? The plantar calcaneal cuboid ligament, right? This particular one. These are plantar calcaneal navicular ligament. That's a long plantar ligament, very long, right? As you can see. So, interphalangeal joints, these are interphalangeal, right? This is distal, medial, proximal, collateral ligaments, right? This is interphalangeal joint. This is collateral ligament. These are metatarsal phalangeal joint, a joint between metatarsal and the phalanges. Plantar ligaments, these are plantar ligaments, that is a tarsal metatarsal joint, right? So metatarsal and tarsal, right? It connects the metatarsal with the tarsal bones. Tarsal metatarsal joint, that's a deep transverse metatarsal ligament, especially here. Yeah, deep transverse metatarsal ligament. All right, so bunions are very common, but what are they, right? I'm sure you've seen bunions. I'm pretty sure if you've observed, you have seen bunions. A lot of people haven't. All right, I see a lot, many on a daily basis, to be honest with you. A bunion occurs on the medial aspect of the first metatarsal phalangeal joint. This is an extremely important area of the foot because it is crossed by tendons and ligaments, which transmit and distribute the body's weight during movement. It is postulated that abnormal stress in the region of the joint may produce the bunion deformity, right? Abnormal stresses in this region of the joint may produce the bunion deformity. So it's actually abnormal stress on the joint, right? So how to avoid getting bunions, Wear shoes that are wide and deep in the toe area with a low heel and a soft sole, right? A lot many people try to use Dr. Scholl's. Avoid high heels and tight pointy shoes. A lot many women love pointy shoes. I've seen some men that like, Gucci, Prada, and all the designer shoes, designer boots that are too tight on their toes, and that's not nice, okay? Use over-the-counter bunion pads or cushions to reduce pressure on the bunions. You can do that, right? Take anti-inflammatory drugs like Ibu or, like aspirin or naproxen or Aleve to reduce pain and swelling. That may cure the symptom, but not, why you have bunions in the first place. So my suggestion is, prevention is better than cure. So what you should do is make sure that you have some sort of, soft heel pad or plantar pad like Dr. Scholl's, where the weight is not, the stress is not actually causing the joints to get inflamed and cause bunions, right? Apply an ice pack or bag of frozen peas wrapped in a towel to the bunion for up to 5 minutes at a time. This is only the way to manage it. It won't go away completely. Not until you cure why you have it in the first place. Orthotics or shoe inserts, right? The padded shoe inserts can help distribute pressure evenly and prevent the bunion from getting worse, right? Physical therapy, ultrasound therapy can help relieve inflammation and pain, yes. Bunion surgery, this is a personal choice. You should discuss your goals, risks, and factors with a physician or a podiatrist, a really good one, right? Bunion surgery can relieve pressure by removing the bony lump or cutting the bone and realigning the joint. Yes, that is a possibility, but my only concern is that you have a bunion right here, right? The bony lump. And you were so negligent that you did not go to a podiatrist sooner, because this is the worst case. Imagine the whole toe is on an angle. Even if you take the lump out, understand what's going on with the whole structure of the bone right here. So how would you fix it, right? So even if you do take the lump out, chances are you'll have to put rods to switch the toes and to make sure that they come in the right position, because now you have to insert rods here to make sure the toes come into the right position, right? So you have to chop this area off, insert rods, and make them straight, and chances are all your toes here will be impacted too, because your structure defines function. And I have no idea how this person survived for this so long, right? So now you also have to wear the right kind of shoes to bring all these toes back in the right place. So it will be very difficult. That's what I can say. Alright, so thank you for watching. I hope you liked the video. Please like and subscribe to my channel. And comment, let me know if you have any questions. I'm very quick to respond to my comments. You're more than welcome to comment. Alright, bye.